When you go to the doctor for some pain relief, usually you just want to feel better and get over your cold, and you don't really think about the dark side of these prescription drugs we use every day. But it's present, and it's there, and it's really, really present in our community and where we live. There's over 52 million people in the United States that have admitted to using prescription drugs when they weren't sick. That's 52 million people that could have ruined their lives. That's 52 million lives that could have been taken. That's 52 million relationships, children, friends, and families that could have been completely destroyed. Today we're going to talk to you about the abuse of prescription drugs, specifically opiates, and what this drug can do to your life and your body, how people get addicted to opiates, and how to treat it. So, what are opiates? Opiates, otherwise known as narcotics, are pain relievers. They're made from opium, which comes from the poppy seed. There's tons of types of opiates. There's natural, synthetic, legal, illegal. They're prescribed for people with diseases like cancer or HIV, and their job is to take the pain away. And they do their job well. They take pain away and they work fine in moderation. But some people abuse it. The way pain relievers work is when you're in pain, your body, the cells in your body produce a thing called prostaglandins. And these travel through your nervous system to your brain, and they tell your brain that you're in pain. So, a kind of natural or not a really strong pain reliever like ibuprofen or Tylenol, what it does is it goes to these cells that are hurt, and they stop the production of this chemical. So, they don't reach the brain as fast or as efficiently as before. So, as long as your body isn't producing the chemical, the pain is eventually going to go away and you won't feel it as much. However, a really strong pain reliever like oxycodone, it's going to go to these cells that are hurt and it's going to completely stop the transit of chemicals. So your brain is never really going to feel this pain. When most people use narcotics in moderation and for short periods of time, they're fine. They don't get addicted. But opiates can produce an intoxicating high if injected or taken orally in high doses. And that's where a lot of people go wrong. It's also an extremely efficient anxiety relief medicine, and that's why it's abused in the U.S. Let me give you an example. Let's say I've had cancer, and I've had cancer since I was 6 years old, and my doctor's been prescribing me morphine to cope with the pain. Some miracle, my cancer goes away, I'm fine, I get to leave the hospital, and I don't have to take that medicine anymore. My body is going to shut down because I'm going to have withdrawal. My body is going to grow so dependent to that drug that I can't cope with it anymore. You see, when you use morphine or opiates for a long period of time, they affect the nerve cells in your brain. And these nerve cells, they're going to grow so used to having that drug there that when they go away, you don't know how to live without it. You can't function without it. In the U.S., there's about 20.4 million Americans above the age of 12 that are illicit opiate users. That's 20.4 million people who are basically ruining their lives. This wonder of science, it can ruin you inside and out.
Opiates have a devastating effect on the body. The way that opiates work is that it binds the specific receptors that control your movement, your moods, and your physiology, which include digestion, body temperature, and breathing. They cause the neurotransmitters to fire at a higher rate as they would in times of extreme stress. More specifically, this overstimulation of the brain causes things such as pupil constriction, which is a result of the eye nerve receptors becoming compromised, nausea and vomiting, which is the body's attempt to detoxify itself. A very common side effect is narcotic bowel syndrome. The symptoms of narcotic bowel syndrome include nausea, vomiting, abdominal distension, and severe constipation. This occurs because the opiates cause the muscles in the gastrointestinal tract to become full of tension. Opiates affect the release of hormones that regulate our sexual behavior, resulting in a decreased sexual drive. Due to the damage of the receptors that regulate our immune system, opiate users often have weakened immune systems. An often fatal result of opiate use is respiratory depression. This occurs because opiates are a central nervous system depressant. Our central nervous system is what controls our heart beating and our breathing. There are also consequences related to the way that they ingest the drug itself. For example, with oral ingestion, which is obviously swallowing the pill, it causes narcotic bowel syndrome, as I spoke of earlier. Inhalation ingestion, also known as snorting, causes damage to the nose tissue and can often result in complete tissue death. This picture right here is a nose where the septum is completely gone from snorting. Intravenous ingestion, also known as shooting up, is the most dangerous. Besides from the obvious risks of sharing contaminated needles and getting things such as HIV or hepatitis C, the use of dirty needles causes things such as skin abscess, and the picture of the ankle was an abscess where a guy had shot up in that area and the doctors had to go in and cut it and debride it. The other one is obviously a complete loss of tissue, and what happens is if the abscess is not taken care of, then that infection spreads to the surrounding tissue. That becomes cellulitis. It's usually treated with IV antibiotics and isn't too much of a big deal. If it's not treated, when it becomes cellulitis, it then turns into osteomyelitis. Osteomyelitis is an infection of the bone. It doesn't usually take very long for an infection to spread to the bone. However, treatment is typically about 6 months in the hospital on strong IV antibiotics. And then even more, if it's not treated, it can turn into what is called, you can become septic, which is when the infection spreads to the bloodstream and goes throughout your entire body. It can also be in septic or septicemia, can be fatal, but more likely they'll catch it in time if they get treatment, and loss of a limb is more common than septicemia. In addition to the effects of the route that it's taken, it plays a horrifying effects on the integumentary system. Most of the visible changes of the integumentary system are caused by the addict themselves picking. Opiates give the sensation of bugs crawling underneath your skin, so they'll pick at their skin until there's lesions and sores and wounds all over. The long-term effects of opiate abuse can cause you to age dramatically. As seen in this picture, these are both women. One is 7 years and the other one, it said, was 3 years. So it's quite obvious what it does to your age. Imagine seeing a woman like this pregnant. Sadly, for most women, addiction to opiates does not stop when they become pregnant.
The number of pregnant women who are abusing during pregnancy has increased dramatically over the past decade. There's actually been a 5-fold increase from 1 in 1,000 to 5 in 1,000 pregnant women who are giving birth while addicted to opiates. The reason for this is that most women who are addicted to opiate drugs have already been using, and they continue to abuse while they're pregnant. Also, prescription drugs are highly available, such as oxycodone, and they're very addictive. Now, opiate abuse crosses many socioeconomic backgrounds. We may think that it's only, in lower income or high-risk patients, but actually anybody can become an opiate abuser. Also, maternal opiate abuse in early pregnancy can lead to congenital heart defects and other complications such as spina bifida. But another major consequence of prenatal drug abuse is that these babies are actually born addicted. Every hour a baby is born addicted to opiates, that's roughly 13,500 babies per year. These babies are born addicted to the opiates, which are passed through the mother's bloodstream. And as you can see on this slide right here, this is the uterine wall of the mother, and this is her blood cell right here, and the yellow dots are the opiates. And you can see they can pass right through into the baby's blood cells. So these babies are ingesting the opiates that the mothers are taking. After these babies are born, they can suffer severe withdrawal symptoms, which can require extensive hospitalization and treatment. Now, these withdrawal symptoms are known as neonatal abstinence syndrome, and this usually occurs during the 2nd or 3rd day of life. Babies born with this syndrome have low birth weight, seizures, breathing problems. They suffer from dehydration. They have difficulties feeding. They suffer from tremors and shaking, are very irritable. Many times these babies can be heard wailing with a high-pitched cry throughout the maternity wards. The treatment for this syndrome can be very time-consuming and costly. Infants spend an average of 16 days in the neonatal intensive care unit, and the average cost of treating a baby with NAS is $53,400. And depending upon the severity of the withdrawal symptoms, the infants are treated with methadone or morphine, and they're gradually weaned from the opiates. So it's just heartbreaking to know that some of these babies are born and have to receive a drug. That's their first thing that they deal with in their life. It's also important that they're carefully monitored. If they don't receive the correct dosage, it can be fatal. Some babies have died from methadone or morphine overdoses, and if they are weaned too soon from the drugs, they may end up back in the hospital. Another major consequence of maternal drug use is that Child Protective Services often step in. When they find out that a baby has been born with neonatal abstinence syndrome, they contact the state, who step in, and they're actually considered victims of child abuse. So it's very important that the mothers receive treatment if they are addicted as soon as they see a doctor. Many doctors screen their patients by asking targeted questions and by doing biochemical testing to see to what extent they may be addicted. So there are treatment options for these pregnant mothers. Coming off of the opiates during pregnancy can be very harmful, and so it's not necessarily safe for them to just quit cold turkey, because the adverse reaction would be that they can actually go into preterm labor, suffer from miscarriage, and even have a stillbirth. So if this detoxification is attempted, the mother should wait until the end of the first trimester. But generally, it's more beneficial if they receive some type of opiate maintenance with methadone or buprenorphine. Although methadone is a very popular treatment option, which we'll hear about later, buprenorphine is actually favorable to the methadone because it has fewer infant withdrawal symptoms on the baby. In 2010, a study was done which they found that the use of buprenorphine, the infant received lower doses of morphine for the treatment of their NAS, and they had a shorter duration of treatment in the hospital stay than with the methadone treatment. It's also considered safe for breastfeeding because very little of the drug actually passes into their bloodstream. So in essence, the goal is not necessarily abstinence from the drugs for the mother at this point, but rather a harm reduction. Pregnant women who receive treatment for their opiate dependency can be more functional. This enables them to receive better prenatal care, get improved nutrition and weight gain, and they're more likely to participate in substance abuse treatment programs, and it enables them to make better lifestyle choices for themselves and for their child.
Now, there are many negative lifestyle effects that come along with abusing a drug, and among those are legal issues, because as we all know, making, selling, or using or having illegal drugs in your possession is against the law. And it's also against the law to give prescription drugs to those who weren't prescribed them by a doctor. And punishments for breaking these laws: you can have a hefty fine, you can enter a rehabilitation program, and they can even send you to jail. And abusing a drug can also really affect relationships that you have. And when a drug becomes a big part of your life, your relationships will suffer, and conflict and breakdowns in communication can even become more common. It can affect your safety, because being under the influence of drugs increases your chances in dangerous situations. The effects of some drugs can cause you to do things that you might not ever think you would ever do. It can also affect your schoolwork, because as you know, if we're on drugs, not really focusing on school that much. And you might not notice the impact on your schoolwork immediately, but that'll come. And habitual drug use will stop you from doing homework, anything responsible, concentrating in class, And it can also have a big effect on your job. Affect your ability to concentrate at work, affect your ability to do your job efficiently. And when you're coming down, they say, on the drug, it can really reduce your ability to focus. And it can put you in deep financial pressure because regular drug users, drugs can become expensive. In extreme situations, people who are addicted to drugs might try anything, including illegal activities such as theft, anything to get their next fix. And it could cause homelessness because you can't pay for your house. Where are you going to live? And there's many ways to kind of tell if somebody is abusing a drug or not. And among those symptoms are like nodding. If somebody, see them starting to fall asleep at an unusual time or an unusual place. And also see their pupils get very, very small. They may cover their arms, try to hide up any marks they may have. And the track marks that they have, the needle marks, usually in between, they try to find the vein on the arm, or maybe even in the back of the leg. And they might be uncoordinated, off balance, dizzy, not knowing what they're doing really well. And if you ever have anyone that you may think has these symptoms or is abusing drugs, great thing to do would be have an intervention or sit them down, talk to them, try to find them some treatment.
Speaking of treatment, there are a lot of different ways you can go about getting off of the drug. A less popular way is detoxification, only because it doesn't really work too well, considering once the person gets off the drug, they could get right back on it again once they're out of the rehabilitation center. A lot of symptoms of withdrawal are agitation, anxiety, tremors, muscle aches, hot and cold flashes, and even in severe cases, nausea, vomiting, diarrhea. They're not life-threatening, but they can be really uncomfortable for the person. Another of the two more popular ways are methadone maintenance. And this came about because since the 1970s, professionals have realized that a lot of people who are on it are not going to willingly get off of it. And so, if they refuse to get off of it, a way to go about it is to administer opiates under medical supervision, and it will allow them to get their fix, but it will greatly reduce the risk of overdose or abuse. It can be continued indefinitely, or the dose can be gradually reduced in order to prepare them for withdrawal. It has been estimated that about 25% of patients eventually become abstinent, 25% continue to take it, and 50% go on and off taking it and not taking it. The second, more popular way is buprenorphine. It's taken about 3 times a week as a tablet held under the tongue, and it will occupy the nerve receptors that would want the opiates, but it produces a mild opiate-like effect that is not as severe and is not as risky for your health. And there is a little bit of a risk of abuse with buprenorphine if you try to dissolve it and inject it. So it's been made available with an opiate neutralizer called Naxalone, which will go into your bloodstream and neutralize the effects of any previous opiates you've had. And there's no real illicit market for it, and there's no danger of diversion. So since 2002, licensed doctors have been able to prescribe it to people to take home and use it themselves. And in conclusion, the path of addiction is a very dangerous one, and it can have very adverse effects on your lifestyle, your body, and if you're pregnant, your baby. And I've stated that there are many different ways to get yourself off of the drug, but the best way to do it is not to do it in the first place. And so it would be a better choice to allow you to save yourself and your life from disaster. Thank you.